A large percentage of U.S. citizens struggle to visit doctors because of the unaffordable medical fees, which puts individuals in undesirable situations. The healthcare costs are still rising faster now than ever. In the 1900s, the healthcare cost was nothing compared to what it is now. An annual healthcare cost of $11,172 per person in 2018 versus just a meager $147 per person in 1960. This is a dramatic rise despite the increase in the value of the dollar currency. Healthcare costs have actually risen faster than the median annual income has. An average person in the US is unable to keep up with the trend of healthcare costs rising, and reform must be needed to address healthcare costs before it is irrevocable. For individuals that require emergency medical treatment, the unaffordable medical fee leads patients to bear the pain, aggravating their injury or leading the individual or family into bankruptcy. Due to this, 39% of Americans with below average income struggle to see doctors because they are worried about the cost, compared to other industrialized nations, 7% in Canada and 1% in the UK. With many patients avoiding treatment due to high costs, this sheds light on the looming political and social issue. The expensive price of healthcare would lead to a rising premium of health insurance and high rates of illness, which will only further widen the gap between the rich and poor. In the US alone, uninsured patients pay 2.5 times more than those who are covered by health insurance, with the gap becoming wider every year. Even as the skyrocketing healthcare costs disproportionately affect populations, even insured people are not in a very pleasant situation. The premiums of their healthcare insurance are rising, and the deductibles are continuously climbing. This has drastic implications, as people who are currently able to afford to pay for their insurance may lose their health insurance soon as the price keeps going up, and this would eventually lessen the population protected with health insurance. According to findings presented from the Commonwealth Fund's latest biennial health insurance survey, Sarah Collins affirms an estimated 45%, or 87 million individuals, were inadequately insured in 2018. Among the 87 million uninsured, approximately 44 million were underinsured due to high out-of-pocket costs and deductibles, up from 29 million in 2010. Moreover, these findings are intensified, as 32% of Medicare expenditures go to care for beneficiaries in the last 2 years of life. This leads to the overuse of procedures and no improvement in quality of life, rather subjecting these patients to discomfort. For those who fall 2 times under the national poverty level, average family payments for health insurance and care is approximately 14% of total family income, 8% between 200% and 400% of poverty, and 5% for 400% or more under poverty. There is a clear distinction between paid out-of-pocket costs and the income scale. According to the Medical Expenditure Panel survey that collects information on healthcare utilization and expenditure, it shows the top 5% of spenders account for almost half of all personal healthcare spending, with $623 billion in 2009, and the top 1% of spenders account for over 20% of spending with $275 billion. The Lorenz curve shown through collected data suggests inequality in healthcare access is at large, with the distribution of income at an angle sharpened at 45 degrees, signaling high inequality among those surveyed. Next, we will focus on causal factors of healthcare on affordability and availability.